Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1793rd day of uninterrupted daily webinar of IFPH. And today our guest speaker is Dr. V.K Karunakar MD, Medical Officer of Government Homeo Dispensary, Nellore. Dr. Karunakar is the former Assistant Professor of Government Homeo Medical College, Kadapa. He is Senior Consultant at Karina Homeo Care, Kadapa, Vinayaga Homeo Hyderabad, Yashodhara Homeo Clinic, Nellore, and he do have more than 14 years of clinical experience. Our topic of discussion is remedy reaction, homeopathy cures. Let's welcome Dr. V.K. Karunakar to the session, and I welcome you all for this session.
So today I would like to discuss the topic is remedy, reaction, and homeopathic cures. So we all know what is meant by remedy and how many varieties of remedies are there in our medical, all other things. But many times we call without any differentiation the medicine and remedy. Hahnemann was clearly stated what is meant by remedy and what is meant by medicine. So what is the need to study or we want to know this topic today means, so most of the timings we are using without your conscious the word remedy and medicine one and another. And also same time, so in any other systems of medicine, only one type of reaction appear after administration of the remedy. But here, so many types of reactions are observed after administration of the remedy into the patient body. So without understanding the remedy reactions, we are unable to stepping forward. We are unable to stepping forward, and also we are not achieve our goal, the curative process. So that's why, so most of the timings without our conscious, we can changing the remedies and we can prescribe irregularly all other remedies without observing or following the sequence in our day-to-day cases. So that's why I would like to discuss, it is a very important and practically very difficult to observe the remedial reaction without our keen observation, our conscious towards the patient reaction to the medicine. So many times the patients were asking, we are stated that there is no side effect, there is no reactions like that. So without understanding the reaction of the body and action of the medicine, what is the action of medicine and what is the reaction of the body to our medicinal action? So very, very clear differentiation is essential for us. So otherwise we are unable to stepping further for making second prescription. So that's why I would take up this topic. So many times I have also committed so many mistakes in observation of what are the outcomes appear in after administration of the remedy. So that's why, so what is mean by a remedy? Everyone knows. So the remedy is indicated medicine and which has ability to cure the disease. How we can select? So based on after careful examination of the patient, we are constituting the totality and we are matching our simillimum with the Metromedica or drug knowledge. So many drugs were mentioned in our Metromedica. Here that there are two types of remedies were observed in Metromedica. What are they? Fully proven remedies, means a full remedy, and partially proven remedies. So which one we want to give in the case? So some of the physicians habituated to prescribe partial similar remedies for getting immediate cure. Some of the physicians are habituated to prescribe fully proven remedies on. So which one is correct, which one is not correct, we are observing after that one. So many remedies are not well proven, which are recorded in your Metromedica. So they are mentioned one or two clinical observation based on clinical observation or on drug proving. So how we can overcome all these difficulties means in the selection of remedy. So most of the timing you have to choose fully proven remedies. If you are even if you are prescribing partial similar remedy to the case, so we are unable to get the curative process, cure the disease. So that's why even you are prescribing partial proven remedy, again you come to the to prescribe a fully proven remedy. So full blown picture, those remedies are which are having full blown picture in our Metromedica. Most of the these two types of remedies we have observed in Maitre Medica. So later, how to select the remedy? So based on totality, after careful examination of the patient, we are select a similar remedy to the case. So here everyone has done good work up to here, but later on, how we can proceed? How we can proceed? This is a very difficult process without knowing how we are going further. So after administration of the remedy, what are the different kinds of reactions are observed? So generally, what are the common observations in all other medical profession? There is no change in the condition, either relieving or disappearance of the condition. But in homeopathy, not like that. Many kinds of reactions are observed. So similarly, after without change, no change after administration of the medicine, what would be the reason? So how we can receive? So that's why here reactions to the medicinal actions are more important. Understanding of the reactions of the body or reaction of the body to the medicinal actions are more important. So for making a good prognosis or a bad prognosis in our case. So that's why the first of all, most of the patient, in my experience, the patients are came to us and complaining of there is no change or condition is worsening. The after taking of the medicine, so many another set of symptoms are appeared. So like that, there are three commonly received three types of answers from the patient's mouth. Number one is no change in my condition. Next one is condition is worsening. Next one is condition is relieving up to some extent. These are complete disappearance. These are the three types of reactions are observed. So what happened really after administration of the medicine or into the patient condition? So before administration, we call as a medicines. After when it cures the disease condition, then we call as a remedy. Remedy is a curative after curing the disease only. So that's why most of the timings, there is no time to the physician or maybe because of some lacking of confidence or towards the principles. So whatever the statement given by the patient, we have received passively and we can change the remedy or we can increasing the potency or continue the same remedy like that. These are the steps we commonly following in our cases. So, but it is not a correct method. You have to interpret the result. Interpretation, careful interpretation. There are three steps in homeopathic process to achieve a perfect cure as per stated in organon of medicine. What are the careful observation of the patient, careful selection of the medicine, and careful interpretation of the outcome result, and to further stepping into that case to achieve a perfect cure. This is the equation when we can reach our goals. So generally after administration of the remedy, what happened? So there may be a disappearance of the symptoms, there may be an amelioration of the symptoms, there may be an increasing of the symptoms. So these are the commonest outcome reactions we are observing after that one. So whenever patient stated there is a worsening or aggravation of the disease or aggravation of his condition, so we can change the remedy. We can change the remedy. Here clearly stated, so maybe Kent has given this type of lesson under the prognostic values. So on 12 Kent observations, in the Robert philosophy, he has given remedy reaction and some other close philosophy also they have given this what happened after remedy administration. So these are more important one. Whoever discussed about this topic, there are three types of common reactions: no change, aggravation, and amelioration. So we have to understood. So when patient stated no change, why? So as per principle stated, whenever administration of the medicine to the patient, definitely it can produce some sort of action. Some sort of action. So some sort of action means, so there is a positive or similar findings related to the disease condition, it can produce, its ability to produce the similar. Definitely, medicine can produce its own symptoms on vital force, either passively or actively. When it receives, definitely it shows some sort of. So as per Newton's third law, every action has got a reaction. Without a reaction, there is no life, there is no back to principles in our drug. This is a common fundamental principle. So that's why either patient stated the outcome reaction without interpretation. So either your medicine is working or not. So what I have observed most of the timing, another important point is either relief or condition is worsening. We are able to escape what happening for interpretation of the result. So we are commonly changing the remedy or some other step we have to implement in those cases without. Why? On the strictly similar principle, on the basis of similarity, I have administered a remedy. So why it fails? Or even sometimes patient says there is a good relief, there is a complete disappearance of the symptoms. We can feel more happy, but don't feel more happy. It was resulting because of your medicine. Unless you know it was resulting because of your medicinal action. Why? Because most of the timings we can feel the disappearance of symptoms is a good sign, but disappearance of symptom is not a good sign in all circumstances. So sometimes it may be bad. So maybe the reasons are the pathology was progressed, or your remedy may not be worked, or the remedy may be worked in a different aspects. These are the different type of actions. Similarly, we can feel bad when our patient comes to us and complaining of the condition is worsening or aggravation of the symptoms. So your remedies doesn't work, or maybe some other outcome observations we can implement or we can thought in our mind. So the aggravations are always not a bad, and ameliorations are always not a good. So according to the situation, when you have interpreted the result, either why aggravation appear in this case, why amelioration appears, either purely based on resulting because of your medicinal action or not, there is a need to analyze. So the analytic technique is more important in interpretation of the result. So sometimes there are new set of symptoms are appear. Sometimes there is a old set of symptoms are appear. So here is also when new set of symptoms are appear, we feel bad and we can change the remedy. When old symptoms are appear, we always feel according to Herrick's law of cure, yes, old symptoms are appear, it is a good, all other things. But maybe either appearance of old symptoms are connected to your case or not. Without confirming, you can feel more happy like that. So without applying the principle which connected to the old one and new one, or the appearance of new symptoms, not a bad. So why? Because these are all the accessory symptoms of the medicine. Sometimes there is a partial appearance of the picture. We are selected a partial similar remedy. You know very well what happened when partial similar remedies are administered to the case. So maybe a complete cure takes place, or a new set of symptoms are appear. The new set of symptoms means accessory symptoms of the medicine. Or sometimes patient has forgotten his old symptoms. He always stated in the first visit what are the symptoms which are problematic to our economy or our condition. So automatically they disappear. The old symptoms are come on to the symptom. It may not be an old symptom. It is in the sequence of the disease, but he forgotten to mention in the initial visit. So these are all not applicable in these circumstances. Herring's law is not applicable, but we can feel Herring's law is appear in this case. My patient condition was good and my remedy is working very well like that. So don't feel like that. So that's why interpretation is very, very important key to analyze whatever the reactions are observed, they are resulting because of your medicinal action or not. So I have discussed one by one another. As per stated, so concluded that there are three types of reactions are observed. So aggravations are in coming to the aggravations means worsening of the condition. Always we feel when patient is also expressed in discomfort or sometimes comfortability, even his condition is, his symptomatology is worsening. So sometimes he is able to tolerate, sometimes he is unable to tolerate, sometimes he was developing some new sort of feeling in his mind, in mind level and physical body level. So try to analyze. So what is meant by aggravations? So aggravations are those factors which are increasing the disease conditions. Generally, in the case taking process, we have to observe, we are giving more importance to the modality, aggravations. So later, after administration of the remedy, the condition is worsening. So this state is called as a aggravation of the disease condition. Regarding aggravation, there are three types of aggravations we have to observe. Number one is disease condition aggravation, disease aggravation, and medicinal aggravation, and homeopathic aggravation. There are three types of aggravations. So which one is good, which one is bad, without knowing, so very difficult to achieve our goals. So coming to the first one, disease aggravation. So what is meant by disease aggravation? Even after administration of the medicine on the basis of totality, so the condition is worsening, condition is worsening. So there was no relief to the patient. So disease can. So how we can know it is a disease aggravation? So what are the signs and symptoms which are appear earlier or at the first visit? Those symptoms are progressing. Or sometimes, so we have to confirm, we have, as per third aphorism, we know the knowledge of the disease and the knowledge of the drugs. So the knowledge of disease has given to you either is a disease symptoms or not. Sometimes in the disease, only one symptom appear in the economy. In that in those circumstances, patient visited in our clinic, we have received only one or two symptoms. The later symptoms are not appear. So if your medicine is not properly worked, what happening? There is no influence of your prescribed medicine on the economy of our patient vital force. The disease condition was progressing. So when the disease condition is progressing, automatically the symptom increasing the intensity of the symptoms and a new set of symptoms are appear. This is natural course of the disease. Natural course of the disease. So here, when naturally the disease was progressing, it means whatever the remedy you have, medicine you have to prescribe, it doesn't work on patient vital force. This is the first condition. How we know? So in these conditions, patient condition is very, very bad or difficulties. The symptomatology grows stronger and disease pathology was stronger, but patient always expressed some amount of discomfort. Compared with earlier, his discomfort was increasing. This is the one important point in the disease aggravation. So either after prescribing your medicine, it was happening, or sometimes your medicine is picking up your vital force. Vital force is flared up. So just you have example. Before throwing a stone onto the honeycomb, there was nothing happening. Once you have to throw a stone onto the honeycomb, the honeybees are flies up and maybe develop. So similar phenomena we have to observe in the patient. Your medicine is not effectively working on vital force of the patient. So it gives a stimulation to that one. Sometimes it creates problem. So generally it has ability to produce similar symptoms, but it may not be added to that one, but it has poking into the vital force. It may facilitate to develop the further a disease condition. It is called a disease aggravation. So in the disease, how we can observe? So similar. So the simple process. Number one is whatever the symptoms which were existing on earlier, it may be grows on continuously increasing. Another one is patient expressed some amount of discomfort. So another one is here new set of symptoms also appear. How we can understand this? Maybe if you have a knowledge of the disease, so it tells to you it is a normal course of the disease. So in those circumstances, what we can do? So this is a commonest phenomenon. Here is also one more misnomer. So immediately those patients which were adapted to the allopathic process, they are giving the first statement is there is no relief. There is no relief. I have recorded many videos also. I am unable to share, but I try to, in the last minute, I have to share those videos for each observation, so on. So, majority of timings, we are also, maybe our remedy is not working. We can change some other remedy, all other things. But you have to strict interrogation of the patient, carefully interpret the result which why. So, my process is in those cases, I have checked what are the symptoms brought by the patient in early years. Tell me, what is the intensity? What is the intensity? Sometimes patient is unable to recognize our positive action of our remedy, positive action of our remedy. When you are carefully interpret and carefully examine the patient after administration of the medicine, so then you are able to find out either medicine action is positive or not. Medicine action is positive or not. I asked, what are your sufferings? He was missing some symptoms. He was stated earlier those symptoms in intensified manner and strongly, but in this circumstances, he was missing those symptoms. When you have in our mind, so that's why here the record keeping is more important. What are the symptoms are recorded, on which base you have to prescribe the remedy is more important. Without knowing that, very difficult to either your remedy is working or not. So this is what I feel in my cases. So I asked, yes, how much cough is there? Earlier, how much cough is there? Compare with, there is a intensity is reduced. Definitely, it is a positive action of our remedy. So intensity is reduced, and some of the and one more important finding, we have to interrogate. So earlier, before prescribing the medicine, at what you are interrogate your modalities. So what about modalities? At what time your cough is there? So definitely earlier nighttime is there, sir. Now nighttime I haven't cough, but daytime occasional I got it. So this is the statement. Without your careful interpret, earlier we are prescribing a remedy on the basis of cough aggravated at night time. Whether may be Bryonia or causticum, irrespective of the remedy, no problem at all. So without careful or keen observing the reactions of the remedy, we are unable to understand. Patient is definitely unable. So without his conscious, he was thrown the positive actions of remedies. When you are not catch up, very difficult to further stepping. It is my opinion, what I have expressed in these things. Another important one, some other, he was telling some other new symptoms. After taking your medicine, doctor, I have developed all the other things. Okay, you have developed, no problem. What about old, earlier you have mentioned? Those nothing, they are not problematic to me now. So what is, it may be also positive symptom, positive action of our drug. Why? Because our remedy is working. So some of the symptoms are disappear. Some of the symptoms are come onto the surface. Why? Because your remedy can be facilitated to eliminate all hidden symptoms in the disease process or disease expression. It is a, so it is clearly stated in our organon of medicine, whenever your remedy may be a partial similar or completely similar. So based on the similarity, the symptomatology. So that's why clearly Kahneman stated, as per my point of view, homeopathic physician is a astrologist towards the patient conditions. Why? Because he knows everything. So if your remedy works, which symptom first relieved to the relieved in the patient, which symptom is last goes, or how we can interpretation of the result, all like that. So like another one is majority of patients are coming, they are adapted to the allopathic or some other medication. They are giving blind statements. There was no results, sir. Or even they are got result, they stated that this much time the homeopathy is efficacious to show the result within short period. They are not observing the original what happening in the economy. They are commonly received from the other public or other things or other people. They are passed their own statements without observing. So that's why how to overcome this means to give a clear instructions to the your patients. You have to observe where you have get the result. If suppose my remedy is worked in your economy, what would be the first positive observation or result? So to observe, to interrogate, to ask, to review the patient's modalities. Definitely your remedy works. So there is a good change in that aspect. This is one point what I have communicated. So another one is, this is a mistake of the patient. And the physician is also to overcome that one. They are simply goes on, maybe they are changing the remedy. If you are changing the remedy, what happening? You are on the right pathway of the cure, but you are deviating your remedial curative pathway from the curative process to incurable state. It was a clear statement. So you have observed, so you are not conscious about your patient outcome result. So you are deviating the pathway. curative pathway. So that's why the remedy reaction definitely related to homeopathic cures, especially in acute diseases and chronic diseases. So clearly stated Hahnemann, the course of the disease is also more important. Why? Because in which direction the disease enters or developing in the body, the similar manner it comes back. Without knowing this pathway, it's a very difficulty to understand this pathway. So that's why, so all these things are essential for understanding your positive result. So without you are understanding this one, you are changing the remedy. When you are changing the remedy, there is no chance of cure. It is also another finding I have observed. The patients are came to me and complaining of something I prescribed remedy. In the next visit, they came and they said, so there is no change. I can change my remedy. I could change remedy. So next visit I come, they stated that they said, sir, earlier remedy gives some amount of positive result. This remedy, this medicine doesn't work. In the last visit, you have stated there is no result, there was no result. So that's why I have to change the medicine in your condition. Why you have to state it? So, but little bit result is there, sir. But I want more result. So the statement was passed. So that's why. But these are the different kinds of statements came from the patient without. So that's why you are instructed clearly to your patient. So where your remedy works, how your remedy works, what are the, if remedy acts, what are the positive findings you have to observe in your disease condition. It is very, very, when patient observe clearly, he was given right statement and you are in the always in the right pathway. When you are not in the right pathway of cure, so very difficult to go. This is one important point regarding disease aggravation. Next, coming to that, or sometimes what happening, another important point, there was a positive result, but middle of that, he was some other factors which are obstructing your curative pathway or remedial action, those things, especially diet or some other exciting, he was exposed to exciting factors, exciting maintaining causes. They are, your remedy is working on that one. There is a positive result. But middle of that, all of a sudden, he was insisting what is the diet and what are the things I have to do or what are the things I hadn't. So the commonly statement, you have to take each and every food item. There was no diet restrictions in homeopathy like that. So it is a right statement. But what is the patient understanding? Oh, doctor said everything you have to take it, all other things. He was eating some other food items which are not tolerate his body, all other things, or he was doing more adversing manner and disturbing the. So clearly, Robert was explained this one under the heading of deflected current. We are deviating the pathway for normal curative process to there is a incurable state. So these are all. Or sometimes based on that one, so we are not implementing the principles of repetition of the doses and changing the remedy. Those principles we are not implementing in the further or the principles of second prescription. You are your own mistake. You are deviating the curative pathway, curable state to incurable state by unnecessarily changing the remedy, unnecessarily repeating the too much repetition of the remedy in the economy to get a positive result. Or some patients are there, they are very, very clever. So you have to instruct 2 or 3 pills, you get the good result, and you have started to drink more than 10 pills or double dose. You try to use double dose. He never said, he never explained all these things without you are interrogating properly with the patient in the second visit. So that's why I insisting most of the time you are not aware of all these things, you are changing the remedy. So that's why in those cases, some amount of bad prognosis will happen. So when you are not aware of this thing. So next, coming to the medicinal aggravation, in the medicinal aggravation, what? So after administration of the medicine, so the condition is worsening. So what is the difference of? So after taking my medicine and my cough is worsening, my pain was worsening, there was no change. In addition to that, some other symptoms also added to my economy, doctor. What is this? So there is he was brought into some different types of quotations in front of us. So what is meant by medicinal aggravation? The medicinal aggravation means, so the new set of symptoms appear on the economy after taking this medicine. So here one more important point. So the accessory symptoms of the medicine is there and the medicinal aggravation is there. Both are different. So the accessory symptoms means some amount of symptoms are developed after administration of that thing. So it may not be a bad. It make it as a complete. It helps to us to make it as a complete prescription. So later on, earlier it was adequate partial prescription. And now it is make it as appearance of the axillary symptom. They are more important to make it as a complete prescription and to achieve a fulfillment of curative process. Later, but in medicinal aggravation, what can sometimes without implementing the guidelines. So the condition is worsening and new set of symptoms are appearing. These new symptoms are pertaining to the medicine. So as per third aphorism, we have a knowledge of the medicine. So a full picture in our mind. So whatever the symptoms brought in the next visit, they are related to whatever the medicine you have to prescribe. Clear, very clear to understand. Very clear to understand. So these are the medicine was proving or the dose was too high or too much repetition of the medicine can produce these type of reactions in the patient. So those symptoms are related to your medicine. So we have what we have while studying the Metromedica. So the knowledge of Metromedica gives an idea about these things. What we can do. So here is also sometimes another, there is a confusion with homeopathic aggravation also. Later I conclude how we can differentiate this homeopathic aggravation and medicinal aggravation and disease. So here what we can do. So in the disease aggravation also, you have to review the case and to prescribe a similar simillimum to the case. This is the only step. So here one more statement also stated. So few physicians are waiting. I prescribed a right remedy to the case. So wait for some time, wait for some times. Definitely will get the result like that. So without here, what our grandmasters or stalwarts are stated, if you are prescribing a medicine on the basis of similarity, there was no time taken immediately. And the way, if you are read Kent literature, so this is a clock, hands up on the clock. In the clock, how the minutes or seconds stick was changing, similarly the disease condition was changing, the positive results are observed. So here, too much waiting after without a positive result in your case, you are waiting for longer period, it is always a bad. It is always a bad. So that's why you have to decide yourself, your remedies work or not. If you are come to the conclusion, yes, my medicine is working, positive result, you will wait for till the completion of your medicinal action period. No problem at all. But without confirming your remedy is working in the patient economy, waiting for how much you are waiting, your case may be a bad and your patient may be a fatal condition, leads to fatal condition. This is another. So that's why so many misnomers are arising in the patient's mind and thrown into the public because of our lack of interpretation towards the reactions of the patient. So this is maybe another important point. So what we can do immediately to antidote. So how we can antidote? So we are refer always in concordance relationship given in the repertoire or Metromedica, which drug is. Many antidotes are there. Here is also again confusing with which remedy has antidote is the action of that one. Or most of the timings we are unnecessarily antidoting the positive things also. Here one more question is also have rise up. So when you are administer the antidote, what happening in the economy? It completely nullifying the action of earlier prescribed medicine or some other different. This is the biggest question in homeopathic minds or some other thing. So when we want to administer the antidote, so clearly stated that when your case is bad, when you are too much repetition of the remedy, or when you are prescribing higher potencies, or when patient is unable to suck up your potency action, you are prescribing, or some deep acting, certain cases, the lycopodium laxus, or don't give in chronic cases like that, or phosphorus in a case of tuberculosis like that. So in those cases, so what is happening if you are prescribing? So this we are observing that one. Most of the timing, our physicians are without conscious, they are also prescribing. There is a fatal conditions are arising in the patient economy, but we are unable to recognize this reaction is resulting because of your wrong prescription or other things. We feel we are good. Once we are prescribing on the basis of similarity, we feel good. Our remedies are nothing can do in the economy of the patient like that. So maybe if you take the histories, most of some patients have died with taking of homeopathic drugs for larger doses, all other things. So that's why Hahnemann was prescribed minimum dose concept, and whenever you are not applying those remedies according to the principle, it may be not a homeopathic one. So it is another important one. So here one fundamental principle is you have to administer the same remedy in the low potencies. It is one point. Another one is in which aspect or what are the symptoms are more problematic to the patient or doing bad. So in that aspect, which remedy is similar to that one, though that one is selected as a antidote to that one. So when 2 or 3 antidotal remedies are there, so you have to prescribe which one is essential or to antidote the previous medicinal action. Means this is the simple procedure to choose one. So next, coming to that one, very important one, homeopathic aggravation. Another important point is homeopathic aggravation. Here in the homeopathic aggravation is, so here there are different versions are here entire individualization process applied here every homeopath. So whatever the things they are applied homeopathic aggravations. When patient come and complaining of my condition is worsening or like this, wait for some time. It is a homeopathic aggravation. My medicines are always, everyone stated that one. After taking homeopathic remedy without increasing the condition, it may not be a similar remedy. It may not be. Why? Because the similarity means it can produce that same set of symptoms. So in that one, so similar natural disease, when there is a clumping of this natural disease all. But what are the facts regarding homeopathic aggravation? So homeopathic aggravation definition is, so the slightest intensification of the existing totality after administration of the medicine, and in which patient feels comfortable. This tagline was very, very important. So patient feels comfortable. So how the patient was comfortable condition? So he was approaching to you, he was consulting you because of his suffering, and after taking the medicine, his condition is worsening, but how the patient feels better. It is also biggest confusion, biggest thing, but it is a very simple. So as per so the definition, according to this definition, slightest intensification of the symptoms. Why homeopathic aggravation means there is a clubbing up a natural disease symptoms and artificial disease symptom. Artificial disease means here the drug producing disease. So there is a clubbing up. Why? Because both are similar. So 1 plus is there, another plus is equal to 2 plus. Like that, here natural disease and artificial disease can produce slightest intensification. But why patient feels comfortable means even though our homeopathic remedy can produce the disease, here the reactivated vital force is more. The vital force is reacted. So always whatever the things here, the natural toxic agents are entering the body can feel it is a toxic. Similarly, the homeopathic remedies also act like a toxic antigen. But here, what is the miracle? To produce similarity, they are clubbing. So that's why vital force never feel it is a toxic like that. So passively receives, and it is able to react. So the reaction of the vital force able to give energy level to tolerate. This is one answer. So that's why even though condition is worsening, patient is able to tolerate. It is very clearly stated that one. So sometimes patient is unable to express, you have to interrogate, even though in spite of your condition is worsening or increasing the symptom, what is your feeling? What is your feeling? So compare with it. They are unconsciously used their words. Yes, I feel better, doctor. Even my condition is worsening like that. If you are not catching that word, you are changing the remedy. If you are catching that word, yes, feels comfortable somewhat, little bit, I am able to adapt or tolerate. So you are wait and watch. You are come to the conclusion. Your word, this type of aggravation is called as a homeopathic aggravation. And here, one more, why the aggravation occurs means a clubbing of a natural disease and artificial disease. But what Hahnemann clearly stated that how we are observing in acute disease and chronic disease are like that. So the homeopathic aggravation is existing very, very short of period. It may happen. So most of the timing, So we are unable to observe the homeopathic action. Why? Because when you have to prescribe exact minimum, then only there is a chance to clubbing of natural and artificial. Otherwise, there is. So most of the timings we are giving a partial similar remedies. So that's why we are unable to observe. Or even in spite of you are prescribing a similar remedy to the case, so here immediately reacted vital force can nullify the disease symptoms. So once disease symptoms are so similar to what people when your medicine is very stronger and similar. So according to the 26th of horizon, the stronger and similar one is administered, the weaker one disappear. Immediately after administration of your remedy, the natural one is disappear. There is no chance of so that's why the natural disease disappears. It facilitates patient is able to tolerate. Patient is able to tolerate in every minute. So immediate. In acute disease, the homeopathic aggravation is appear for very short period. Within half an hour, very short period. So in the chronic diseases, it may be so as per literature, up to a few minutes to few hours, maximum 3 hours time, the homeopathic aggravation appear. Similarly, in chronic diseases, so few hours to few days, maybe 3 days, or third hour to 3 days. So that's why we have to observe this type of increasing the symptoms within 3 hours in acute disease and 3 days in chronic disease, whatever the outcome results appear. So what is the prognosis in these three conditions? In the disease diagnosis, how we can differentiate means in the disease aggravation, patient condition is worsening, patient condition is bad. So there is a symptoms are still going strong and patient expression is very dull and fatal. So in the medicinal aggravation, the patient condition is very bad and symptoms are growing stronger. In the homeopathic aggravation, patient condition is going stronger, but patient feeling is better. So the betterment always decides if the type of aggravation is homeopathic aggravation, and the medicinal aggravation, the patient condition is bad. Whatever the disease, the symptoms which are pertaining to the medicine are stronger towards the medicinal action. In the natural disease aggravation, they are developing towards the stronger towards the disease condition. When you are aware, having drug knowledge and disease knowledge, so very easy to differentiate this one. In the homeopathic aggravation, the positive, what is the prognosis? So in the disease aggravation, prognosis is bad. In the medicinal aggravation, prognosis is bad. And homeopathic aggravation, the prognosis is good. So the prognosis is good. What here is also most of the timings we are committed. The commit mistake is there is a good result. We can repeat the medicine or changing the medicine like that. So here clearly stated animal wait and watch technique. Without observing, without confirming your remedy is working, this aggravation is a homeopathic aggravation. This waiting is a very foolish reaction. So that's why you are well aware of all these things. So these are all different types of reactions. Another important finding is so sometimes the inter obstacles or the factors which are adversely acted, they are involved. You are also knowing. So another different kinds of, if you go to the Kent literature, all other things, there are different types of, some patients are there. So whatever the remedy you have to administer, yes, I feel better, doctor. And one more important factor, what I have observed in the day-to-day practice, so most of the patients are, so while using medicine, I feel so comfortable, doctor. Yesterday, my medicine was completed, then started the condition. Is it right? So in which condition it is right, in which condition it may not be a right one, you are aware. So patient stated that one, so you are immediately repeat the same medicine or changing the remedy is a bad step in your prognostic aspect. So here what it is a real or not. Most of the timings, the psychological, if your remedy is worked, so there was no chance of developing how much intensity was there and earlier, the same intensity couldn't appear in the patient economy. This is the first point. So the patient psychological impact is quite different without understanding either it may be a psychological impact are real happening. So very difficult to stepping in further aspects. So another, this is another. And some few patients are there, their own statements without observing their own statement, that is called as a hysterical reactions, maybe hysterical reaction. They're after taking your medicine, doctor, for a few seconds I have developed suffocation, all some other things are like that. They were pretending in front of us. Oh, we are also sometimes we are afraid. So either maybe really it had this situation is resulting because of your medicine or not. So when you are dare enoughly to observe the facts clearly, so in the patient economy, easy to understand either it happened because of your medicine or their psychological feeling or not. So the hysterical patients or hypochondriacal patients, it's very difficult to understand these type of reactions. They are exaggerated their own, even positive result or negative result. Or sometimes patient get the positive result, they said nothing, no result, doctor. I used many times within short period. How it is possible? Your homeopathic remedy is possible to produce a relief within short period. How? Maybe these type of reactions I recorded, I want to show, but really within fraction of seconds. So our remedy works within fraction of seconds. Recently, I was attended one camp. So a patient, sister was, whoever act like a sister A&M worker. So he was approaching me. I have severe headache. So I'm a severe again. They was showing like that. I have headache here only that one. I was reeling sensation and vomiting sensation, all other things. So maybe which side? So this is the only indication I had taken up that one in the acute cases. So the fingertip was showing that one, and in the especially left side. So I have given only one drug, Tuja, nail driven into the head. What Tuja drug, one dose. Wait for some time. Sit here only for a few minutes. So after that, I asked, what is your condition? So many people are there, Ayush department people, Ayurvedic or Unani, other thing. Everyone is eagerly waiting what type of reaction comes from the patient mouth or other things. Patient said clearly, yes, I got relief, doctor. Oh, everyone is surprised. Is it possible? I also measured time. So when I was worked earlier in my hospital also, I have given a time to the patient after administration of the remedy or wait for few minutes and observe either you get the positive result or not. So a few patients are said a positive result is there, and few patients are said there was no result, doctor, nothing. Is it happening in my economy like that? Yes. So is it patient, what are the statements given by the patient? He said either he was get a relief or no relief, either both are real statements or not. So most of the timing, because of some patients are having, maybe he was insisting within fraction of seconds to get the result like that. Their mind is worked towards that only psychological impaction. They stated as positive result. And another one is, so maybe for the sake of doctor's satisfaction, they stated, yes, good, I have result. Or some patients are there. They don't have time to wait for few seconds in our OPD room, all other things. They are stated also another important type of things. But here I applied only one principle. Either you got a patient get a good result, positive, real result or not, you have to interrogate. So what is the facial expression and what is the intensity you was expressing? In these aspects, there will be a change, definitely change. Our remedy, as stated, literature, our homeopathic remedies are worked more quicker and faster than the injections. Is it possible or not? Definitely possible. May not be possible in all cases, but how many cases were possible you want to show? So you have to observe. I asked patient, so how we are confirming? Patient blindly stated, I get a relief, is don't believe. He started explaining, yes, doctor, I have previously here, now it was there. There is some sort of different type of feeling developed in my body. Like he tried to explain some statements. So then you have to believe there is a positive result in the patient economy. Your remedy is working or not. So similarly, one more case is also have. So one allopathic sister, PhD sister, he was developing. There is a continuous watering, hyporia. So along with the Pariza, so she was has taken a citizen or some other medicines also like that, and came to me and approached me. I prescribed simply Palestella, Euphoria. So that one. within fraction of seconds, the euphoria stops. So the type of reactions observed, so without aware of all these things there. Similarly, I have find out if you go to the Kent literature, aggravation comes first, then later amelioration, and there was no aggravation, or sometimes every patient stated that for everything there is a like mathematical equations. So why the patient get a relief? Why not patient unable to get the relief? Or why aggravations comes and why ameliorations comes, and one by one, either aggravation followed by amelioration followed by aggravation. So all these things are explained clearly. So in this one, where is the mistake? Either patient or the physician or drug, maybe a superficial drug or deep acting drug, or that may be no sode or wrongly administration remedies, all other things. These are more important ones. So everything is within our hands. Everything is within our hand. So I don't want to, or in a case of idiosyncratic patients, so they want to prove everything, even so many types of reaction. In my body, heat was generated. In my body, something is happening after taking this remedy. There are different, my kidney problem was developed, or my heart is not functioning well after taking this medicine. Like the different kinds of reactions are brought into your in front of you. So all carefully you are observing, and the interpretation of these outcome reactions are for that. Here, keep in our mind one point, as stated by Hahnemann, the potentized remedy never produce such type of ill reactions in the economy when you are administered according to the principle. So the minimum dose concept, and sometimes the physiological doses are prescribed. They are therapeutically acted, all other things. So sometimes there was no access. Sometimes one patient is there, they have developed pain in abdomen after administration of the remedy. Pain suddenly disappear. Everyone feels, but within short period, patient was died because of there is a rupturing of peptic ulcer in that one. So something battle naturally also disappearance of the symptom after administration of the remedy, disappearance of the symptom. You are able to differentiate these symptoms are disappear purely because of your medicine or not. So this helps to you to understand either your remedies worked in curative pathway. And one more last. So the remedy works. Remedy always can produce cures. The reaction, whatever, either may be a bad or good reaction, you are able to understand, apply the principle, either good reaction, yes, you feel good, and bad reaction, why it happening, where we have committed a mistake, we have tried to correct it automatically. Another step, what is our aim? Homeopathic cures. So nowadays, is it possible to cure? It is a biggest question in every homeopathic mind. So why? Because what is the cure definition? So when they are using in the acute disease and chronic disease, also different aspect. Chronic disease, a lifelong disease, everyone. Is it possible or not? Or middle of that, so many people are using some other medications also, how we can decide. So this is a very simple, in my point of view, if you are asking, what are the symptoms we brought to you, they are not appear for a period of time, or even earlier, those people were feeling in adverse. So those environment factors are adversing to healthy condition, so he is able to maintain, he is able to enjoying those adverse factor circumstances, and there is no recurrence of the disease conditions all or whatever the symptoms are, he is cope up with adaptation, even though there was no cure. So patient able to cope up in each and every condition, either it may be cancer, all conditions may not be cured. So clearly stated that one Hahnemann, what are the cases are curable, what are the cases are incurable. In a case of incurable cases, the palliation takes place, all other things. So
Thank you,
what
doctor.
happening, either it may be acute or chronic.
So,
Sir, I concluded, sir. My conclusion is either it may be acute or chronic. So the remedy can produce some change. If it fails to produce no change, why? If it produces any change, either it may be positive or not, you have to observe, apply the principle and other thing. So if it is a positive, wait for sometimes or whatever the period, no problem at all. When it is a bad, you have to try to correct it. So otherwise, we are not doing justice to the patient. It is also another important point. So most of the timings, our homeopathic physicians are escaped. There is no chance of anyone is catch hold. Why? Because only another homeopathic physician, we have a sound knowledge in the homeopathic principle. He is the only person to catch either earlier physician was done good or bad. Whatever the things are happening by our homeopathic medicine. So that's why whatever that one. So the perfect careful observation and careful interpretation, the outcome, and we are achieving the sole aim of the homeopathic physician stated as per 17th aphorism in his organon of medicine. So to provide a best ideal cures to the patients. So I concluded, sir. Please, if you have any question, and please write. But I have all videos for each observation, but I am unable to show you, sir, because of some
We will do
lacking
it
of
in another session,
technical.
sir. It's an excellent
Yeah,
session,
okay,
very
definitely.
motivating.
Yeah.
We are
Please
sticking to the
ask any
cardinals,
question is there,
and
sir.
you wonderfully explained everything cardinal with homeopathy. And I appreciate the session, and we need to conclude now because it's a time to conclude. And another important announcement of IFPH is awaiting, and our Vice President is joining with us, Dr. Shaji Kudiyat. Let us welcome him for an important announcement. After that, we can just conclude the session. Sir,
Yeah, I
please.
concluded, sir.
Just a minute.
If any question is there, please ask or raise.
Sir, please unmute from your side.
Thank you, doctor. Thank you, doctor, for my invitation. I wish to announce some important things. Before that, I congratulated the doctor who energetically, enthusiastically, and passionately presented the concept. I have one more request to you, doctor, because it was a wonderful presentation. You should give little more time for others to ask questions also next time when you present, because you
Definitely, sir.
already end up and no time to ask you questions. And here I am to declare and to announce something very important connected to IFPH. As a vice president of IFPH, we are able to conduct these uninterrupted daily Zoom meeting for last 5 years, which never happened in the history of medicine, in the entire history of medicine. So we made history, and it should be a great celebration. Every faculty who presented in our platform so far, we are planning to invite. It is our privilege and it is an honor for us to have you as faculties, and we are passionate homeopaths of the entire world. We are a creamy layer of homeopaths around the world. So we should get together, celebrate this, and make a memory out of it for our entire life. It was a huge effort, passionately done. So we have arranged a one-day celebration in Kerala, in Taj Vivanta, Cochin. Invite all of you. Please note the date, September 28, 2025. September 28, Sunday 2025. So it will be, we need to make it as a historically important, huge function in homeopathy. And I invite all of you to collectively work together as a team to bring all our faculties and others who joined us from different parts of the world to our celebrations. We should enjoy, we should celebrate and make it a memorable event. So I wish to declare the delegate fees so that you can delegate earlier, so that the time will be the slots will be fixed for you with a minimal rate. For the Indian delegate, the delegate's fees will be 3,000 rupees, and for accompanying person 2,500 rupees. It will be a one-day event. It will meet the registration for the event. For your travel, transportation and accommodation should be extra, that you should bear that. You should participate or conduct in Kerala as after this program or before the program. That is also your responsibility. But we will be there to help you collectively, so that we together can travel and enjoy the beauty of Kerala, which is known as God's own country. And a lot of things are here waiting for you. So I wish all, and the international delegate fee is And this delegate fee is an early bird registration till August 15. So I appreciate all of you to register and reserve your slots, your registration delegate as a delegate before the August 15 deadline with the minimal fees. After the August 15 till September 20, it will be 3,500 for Indian delegates, and accompanying person it will be 3,000. Then after September 20 onwards, it will be considered as a spot registration. Every delegate need to pay 4,000 each as a registration fees. So that will be for Indian delegates. But for the foreign delegates, we kept it a minimal with the $200 for the delegates, and the accompanying persons $150 till August 15, and after that it will be $250 for the delegate and the $200 for the accompanying person. So and that will be also till September 20, and after September 20th onwards it will be $300 for all registrants. Appreciate your registration through our website or through personal emails as soon as possible, including the payment to the official account of IFPH. Only all the payments should be made only through the official account of IFPH. Don't make any other payments without without getting consent from the treasurer of IFPH. Take note of this. So we appreciate all the team of IFPH, all the faculties, all the lovers and supporters and well-wishers of homeopathy to join our program, make it as a historically important, grand success and memorable event. Inviting all of you. Thank you very much. See you all at Cochin, Taj Vivanda on September 28, 2025. See you all. Bye. Thank you.
Yeah, okay, sir. Thank you.
Thank you, sir. Thank you, sir. And it was speaking there, Dr. Shaji Kudiyat was speaking to us, wishing to meet you all. It will be a grand celebration. It's on September 28th, 2025, and please spread the news. And it's time to conclude. On behalf of IFPH, I thank Dr. Karunakar for taking this wonderful, magnanimous class. He's full of energy. We all know about him. And please come again to our floor. We'll be waiting for your
next time with videos.
Thank you, sir. Thank you.
Yeah.
And thank you all for the session, for attending this session. And it's time to start the Malayalam session. Over to Dr. Shaila.